Hi guys, it's Gemma here from Fundamental Sports and Fitness, and today we've got the Muscles and Joints 101 session. So looking at the different muscles of the body, how they relate to the joints, and the movements that can occur with them. And I know sometimes, like when you're getting injured and people are mentioning, oh, it's this area of your body or it's that area of your body, sometimes you want to be a little bit more specific and know exactly which muscles are affected by it. But also, sometimes the medical advice you might get can seem very overwhelming at times, and sometimes quite complicated, particularly if you're hearing some of the Latin names for the muscles and not entirely sure where they are placed within the body. So what I thought we'd do is kind of go through where the muscles are in the body, sort of the actions they create at the joints, and then give you some exercises, some stretches that you can do to sometimes help alleviate any injuries, any pains or niggles that you might be having around that area. But also they're good practices to get into, particularly from a running point of view. And that's kind of where we're going to focus a lot of our attention today, is on your lower body, sort of lower back down to your feet, and look at sort of and specifically focus on that area. If it's something that you've enjoyed and got out of, then let me know and we could potentially do an upper body one on another session. But I thought that would be a good start for us. Now, I've got some pictures printed up of the muscles, so we can have a look at those, and I'll kind of run through where they all are, and then we'll kind of relate them back to my body and the positions on there, and as I say, go into some of the movements that occur with them. So I'm just going to flip the screen round, and hopefully we can now see our human bodies. Okay, so very nicely done. And what we'll do, we'll start on the back of the body. Okay, so we're looking here, working sort of from our glutes down. Now, I haven't labelled it on, but we've also got here, so from your lower back, we've got sort of your erector spinae, which is coming up here, and then your quadratus lumborum. So part of, if you are getting sort of lower back pain or things feeling tight, that's all within this section here. Okay, so much deeper within the muscle tissues. And then we start as we come into your glutes. Okay, so over onto this section here. Now, most of you will know we've got your glute max, which is the whole section here. Okay, the big muscle body that's covering it all. Okay, underneath that, we then have your glute med. Okay, now some of you will know from a running point that if you've had a sports massage and elbows gets dug in there, then it's usually your glute med that's quite tight, and that comes in and attaches just on the top of your pelvis. So again, any lower back pain, that's why your glutes are usually involved within it a little bit. And then underneath it all is then your glute minimus. Okay, so you can sort of see why if any of this area becomes tight, it pulls down onto your lower back, making it a little bit sore and tender. If we work then lower down, you're then coming onto your hamstring group. Now, 3 hamstring muscles. Your main one, your bicep femoris. Okay, so that runs straight down the middle. Okay, and is the main muscle involved within sort of moving your hamstrings. And then as we go across onto the side, okay, you've got your semitendinosus and your semimembranosus running down sort of the more middle, the medial side of your back of your leg. Okay, now if you're thinking within all of those, you might have tight hamstrings. Well, if you have a look, they come in and attach right underneath your glutes. So that's why you can then sort of feel that slight pulling sensation if anything's coming up there. Then at the back of your knee, you've got your popliteus. Okay, so sometimes I know people have said they're not sure if it's ligaments or muscle. That muscle in there is really important for then that straightening and locking out of your leg and knee. Okay. Coming down a little bit further, okay, so you've got your calf, and okay, so it's all of this section here. And your calf, your main muscles that we're looking at are your gastrocnemius, so these 2 big muscles here, okay, and then taking a little bit further down, we then have your soleus, and then that comes in and attaches just underneath your Achilles tendon. So again, when those areas become tight, that's why it can become a little bit sore. And you also have your flexors, so your ankle flexors down onto here, and your tibialis posterior. Okay, so it comes right underneath your shin bone. So that's as if we're looking at the back of your body. Okay, then if we come over and we turn over onto the front, we've got lots of muscles on the front, so I kind of start at the top and I'll work our way down. And again, when we then get to the joints section, we'll explain why everything involved within there. So we've got your TFL, so your tensor fasciae lata. Now, loads of people say that they have IT band problems. Your IT band runs down the side of your leg, down here, comes into your knee. But the main muscle that is involved within the movement, okay, is your TFL. Okay, if your TFL is tight, that is what pulls on your IT band. Okay, and that's what can then cause that inflammation, okay, around your knee and then cause that knee pain. So it's really important that you stretch, okay, and do some of that trigger point work or foam rolling within your TFL. And that can usually help release some of that pain. We'll then take it into your groin. Okay, so in here we've got your adductors. Okay, and we've got the set of muscles that make up there. There's 5 of them. Okay, your adductor longus, magnus, and brevis. Okay, and they're coming in as this section just here. Okay, and then your pectineus runs from here all the way down, and the same with your gracilis, just a little bit further in. So anything that involves moving your leg inwards, we've got then your adductors. Okay, so again, that's why if anything gets pulled, that sort of series of muscles can be quite complex within there when you're working. Okay, if we then go onto your quads, okay, so the front of your thigh, okay, looking at this section of muscle here now, you've got your rectus femoris, so the big muscle that runs down the front of your leg, and that's usually the one that you'll be able to feel. Okay, your vastus lateralis runs down the outside of your thigh. Okay, and usually, okay, if you're then foam rolling, it'll be your vastus lateralis you'd then be feeling if you were going over what would be your IT band, and that's the side that would be quite painful. Okay, your vastus medialis, okay, the big bulgy muscle on the inside of your leg, okay, coming down here, and then your vastus intermedialis comes just underneath it. Okay, so again, a nice complex bunch of muscles that are working your quads. And then we have one of the longest muscles that comes in and attaches, your sartorius, comes and attaches from up here, okay, all the way down onto your knee. So again, you may find if you're getting any knee pain or tight hip flexors, tight quads, this muscle here is really important for that movement section. Okay. Now, we've already mentioned about your calves and the back of your leg, but if we come over the front, you've got your tibialis anterior, so that runs down the side of your shin. So if you feel like you've had shin splints in the past, or I'm trying to think, if you've been running and things are slightly more painful down the front, okay, one of the reasons could be is that your tibialis anterior, okay, is slightly tighter. Your perineals run again down the outside of your leg and coming down here. Again, for runners, because of sort of that ankle stability, your perineals are really important within that movement. Okay, so again, when you're foam rolling down the side of your leg, okay, or if you're feeling like you're getting any ankle pain or foot pain, your perineals are a really good one to massage and foam roll. Okay, and that will again release some of that pain or tightness you're maybe feeling within your ankles. And you then have your extensors. Okay, so again, the movement that makes your foot go up and down. So they're kind of the main muscles we're looking at within the body. So you've got to think that when you're, the movements that you may feel at the joints, let me flip the screen round again so you can see me. There we go. So the main movements you then may feel at the joints. So within our hips, we have flexion and extension. So from there, that's that movement of our leg forward and backwards. Okay, so that would be you flexing and extending your hip. Okay, we then have that adduction and abduction. Okay, so the out to the side and back across. Okay, horizontal flexion extension, we're coming in and out. Okay, and you've also got sort of that small movement of that internal rotation and external rotation. So you can see sort of why your hip is so important when you're running, and also the muscles that are involved within all of those actions. You'll find it's your glutes, the majority that are responsible for it. Your hip flexors. So again, we're looking up here. Didn't really talk too much about your psoas. So that's coming in and attaching down here, but also attaching up. Okay. And just on that top of your pelvis into your ribs. And again, when that becomes tight, that's a restricted movement that you'd be then having. Okay, so when you're thinking about stretching and exercises that you could be doing, your glute stretch is always going to be a really important one that I'd be looking at. So you want to be laying down on your back. Okay, ankle across your knee. Okay, looping your hands through your legs and just gently pulling towards you. And then for your glutes, that's a lovely stretch just to release anything that's going on in here and relax those tight hips. You've also got one which I give to most of my runners, something called a groiner. Now, from this one, you'd be in that sort of high mountain climber position, but then bringing your foot as high round as you can over to your hand. Okay, and just relaxing down into it. And within that, you would then feel a lovely stretch down into that adductor group of muscles, okay, and down into your quads. So again, those are really important bits to focus on and release those tight hips. Your knees are pretty simple muscle group from a movement point of view. Okay, we're looking here, so we've got flexion and extension. Okay, so that movement up and down. Okay, hamstrings and quads responsible for the main movements that you've got going on, and within those ones we'll look at, I'll show you the hip flexor stretch and then a hamstring stretch with the resistance bands. So to release and relax your hip flexors, what we do, okay, you're on that half kneeling position, front foot over, and then just gently push forward and you will feel that stretch coming up, okay, starting down here within your legs, so that hamstring group, so your quad group, okay, and coming up down here through your psoas and then attaching in. So again, that's a lovely one for your hip flexors. And then for your hamstrings, you want to make sure that you're trying to keep your leg as straight as possible. So if you're like me and have particularly tight hamstrings, I quite like using a resistance band. So hook a resistance band over your foot. It means you can then keep your leg nice and straight. And then you can use the resistance band just to pull your leg closer towards you. Okay, and again, just hold that stretch. So again, nice and simple movements to there be looking at, and two great stretches that you can be doing and introduce to release any of the tight muscles. Your ankles. Okay, so movements in and around our ankles. Okay, so we've got plantar flexion, so pointing our toes down, dorsiflexion, pointing our toes up. Okay, we've got internal rotation, external rotation, okay, eversion and inversion, okay. So again, that movement of our foot, you can't really sit too well on my ankles, but we're coming in and out. So again, when you're looking at ankle stability, okay, all of those small muscles in and around your ankles are going to be super important. And again, remember we said about those perineals becoming tight, those are all those responsible bits for it. Now, your calf stretch is going to be a good one to release the back of your ankles. Okay, so again, go with one foot straight. Okay, and the key bit, make sure both your feet are pointing forwards. Okay, and then from that position, just gently push forwards on that front knee, keeping your back knee nice and straight. Okay, now from here, you'll feel the stretch much more in your gastroc, so the top of your calf. Now, if you bend your knee, you will then start to feel the stretch more into your soleus. Okay, so remember, that's that bottom bit of your leg. So that's how we'd look at stretching your calf. Again, really nice and simple, nothing too complicated. Your ankle is also a really nice one to introduce the spiky ball into. Now you can then massage in and around. Okay, so that top, if you let me move my foot back, now you can see it a little bit more. In and around here, okay, and that just gets into here. Or again, as we talked about those perineals, coming in and up round the back of your Achilles and coming up the side. For those of you that might suffer from plantar fasciitis or sort of that tightening of the bottom of your foot. Okay, get the spiky ball on the bottom of your foot, and again, those gentle movements and rolling forward and backwards, okay, and side to side. So you've got to remember, any muscles that are attaching on the bottom of your foot, they're all coming up into your calf. Okay, so tight calves are going to lead to those problems. And we'll finish off then with your lower back. Okay, so again, remember we talked about your glutes. If they become tight, your lower back then has a few issues going on with it as well. So the movements within your lower back, okay, if we're looking here, I mean, you've got to think your whole back is going to move as your main bit, but we'll focus just on your lower. So we have got that extension, that flexion, that forward movement, okay, lateral flexion as we're moving side to side. Okay, we're going to have a bit of rotation in there, okay, as you're moving along. So as we said, from a muscle point of view, the bits that are going to become tighter are your QL, so that quadratus lumborum, and that always gives me a few issues when I've got my lower back issues start to kick off. I can feel the sides of my back becoming much tighter. So from a stretching point of view, a lumbar rotation is quite nice. Now again, do it very controlled to make sure you don't get any issues, but I like it that keep both back flat on the floor, knees bent, and then from that position just slowly rotate your knees, okay, over to one side, keeping them together, and only go as far as comfortably possible before you bring back to the middle and over to the other side. Again, just make sure it is a really slow and controlled movement to help you as you're doing it. So yeah, I hope that's given you a little bit of an insight there into sort of the main muscles of the lower body that are all involved when you're coming into sort of a running perspective. We've looked at sort of the movements that are involved within the joints and some stretches and some exercises that you could do if you're feeling those areas becoming particularly tight. And that's where we break it down with our injury clinic. So the guys that come onto the programme, we look at sort of the main muscles that are affected within one part of their body. We then focus on some testing to see if we're right with what we're thinking might be going on with them. And then I design their programmes and their plans, looking at an element of stretches and exercises to help. At the moment, we've got a few of the guys on the programme are doing really well. We've had some people come back on to look at other areas and other injuries that have been causing them a few problems. And everybody now, from last year, basically having to take a complete season off from running because of injuries, issues and things going on with them, everybody now is back to doing 5Ks, which is amazing. And a lot of people weren't expecting those type of results because the issues that they've been having have been going on for such a long time for them. So going on that kind of thing, we do have loads of time in our hands at the moment, and I've been working quite a lot on my shoulder to rehab that, and found I've done really, really well and been quite positive and pleased with the results that I've had with it, purely because I've had more time on my hands at the moment, being at home a lot more. So if you are wanting to come and join us on our injury clinic, we've got the next one starting in a couple of weeks. We're doing everything online at the moment. So we have our consultation, we find out what's going on with you, I design your plan, we get it emailed over to you, and then we go through all the videos of the exercises. You can watch me doing them, I can check your technique, and each session we're again online as the group, have a nice chat with each other, find out sort of what things we've been doing really well, the little achievements that we've been having, so going out and running 3k, 5k, and sort of anything that's been getting us down over that week. So again, we can kind of tackle that and find out if any injuries are sort of a bit more persistent, if we need to work on some different muscles and joints a little bit more. So yeah, it's a really good atmosphere to be in, joining us online each week and seeing sort of the progressions that everybody's making with the programmes. So yeah, if you want to come and join us, I'll put the link to the programme in the comments section. And then you can head over to our website and get yourself booked on. I say it's all online at the moment, so you can do it in the comfort of your own home as you're in an evening. But say you join us once a week to have your PT session, your rehab session, and we go through everything with you. So I hope you've got something from our Muscles and Joints 101. And as I say, if it's an upper body session that you're after, let me know, and then we can go through more of the shoulders, arms and neck and upper back, because I know sort of that can be causing any issues, particularly from an obstacle racing side of things. So I hope you all have a good day, guys, and I'll see you soon.